For this morning, decided to do POTS for Group 5 with Andrew, Braden, and myself. So a little bit of what it is. It's a condition that affects the circulation or blood flow, and it involves the autonomic nervous system, which controls and regulates vital bodily functions, and sympathetic nervous system. Little background, one of my buddies back in Texas is actually dealing with this right now, and it's really taken a big toll on his life. So as we continue to learn about this, I'll give some insight of what he's been dealing with. So some risk factors that come with POTS. The majority of patients are women from ages 13 to 50 years old, and about 450,000 people suffer from POTS in the United States. Symptoms and assessments. Symptoms can be uncomfortable and frightening experiences. Patients with POTS usually suffer from 2 or more of the many symptoms listed below. Not all patients with POTS will have all of these symptoms, so some of those symptoms would be high to low blood pressure, high to low heart rate, racing heart rate, chest pain, dizziness, lightheadedness, especially in standing up, and fainting or near fainting. My buddy has actually experienced like almost all of those. He says that like he always has chest pain. He's fainted a couple times during his doctor visits. He always feels pretty much dizzy or lightheadedness. And he has like this thing where if he stands up super quick, or even if he stands up at all, he can feel his heart rate just accelerating. And then like throughout the day afterwards, he can just be sitting there and feel his heart rate like beating throughout his entire body, like places you usually wouldn't feel that. Some causes, so still working to identify the root causes and pathology of POTS. There are several underlying diseases though and conditions that are known to cause it or be associated with it. So some of those underlying diseases are just diabetes or pre-diabetes, autoimmune diseases, vitamin deficiencies, deconditioning, and mitochondrial diseases, and there's like a huge list of plenty more. My friend, he was diagnosed with POTS not too long ago after struggling with it for maybe up to 6 months, and now that they've diagnosed him with POTS, now they're looking for any type of underlying diseases, including autoimmune diseases that they're still trying to determine. So into the diagnosis, a tilt table test is the gold standard of POTS diagnosis, alongside blood and urine testing for the causes of POTS and conditions that may mimic it. A QSART is a test that measures the autonomic nerves that control the sweating. And autonomic breathing test is to measure how your blood rates and pressures responds during exercise. Also the TST, tuberculin skin test, skin nerve biopsy, echocardiogram, and blood volume and hemodynamic studies. My buddy usually has to test his blood like every day, I think, or multiple times a day, I'm not sure, but. Other types of treatments include medications like salt tablets, fludrocortisone, midodrine, and a beta blocker that may be prescribed to control it. Prognosis and follow-up. There's currently no cure for POTS. However, researchers believe that some patients will see an improvement over time. But with the proper lifestyle adjustments, exercise, diet, and medical treatments, many patients see an improvement in their quality of life. If an underlying cause can be identified, and if that cause is treatable, the POTS symptoms may subside while the prognosis is good for most patients. Researchers have noted that some patients will not improve and may worsen over time, which is accurate with my friend. Throughout this, he has not had the proper lifestyle adjustments, has not had any exercise, basically doesn't eat, and tries to stay away from doctors because he has fainted in the past couple of visits, so now he's pretty fearful of doctor visits, and that takes away the opportunity to have treatments. So that's proof that if you don't do those types of things, you don't live that type of lifestyle that's going to improve. It's only going to worsen over time, and he's a prime example of that, because now it's affected his relationships with his parents, his friendships, and now it's become almost like a mental issue for him. Unfortunately, that has caused him to not even be able to see anyone. He's been locked in his house for a while, especially with COVID. It's definitely caused a lot of fear in his heart. So that just shows how a problem like this can affect one that doesn't live up to the proper lifestyle adjustments that can help treat that. And those are my references. That's all I got for you. Thank you.